Hi, I'm Dr. Pruner, and today we're going to be discussing compression stockings and how you wear them, how you put them on, little tricks on how to do that, and what would be indicated for wearing them in the first place. In our shoe store, we have a bunch of different kinds of compression stockings. In particular, we've got this, the green box here that is your traditional compression wear stocking. Over here, you have this blue box that is a dress type stocking, and then this one here is a hosiery type. Now, regardless of if it says men or women's, to each his own, whichever one you choose is fine. It really comes down to comfort and which one you're going to wear, and that's how the doctors usually want you to choose unless otherwise specified. But we're going to talk about how to put these on and the differences between them. So I'm going to use this green box as an example for how to apply them, but first I want you to pay attention to the number up here. This 15 to 20 millimeters mercury is how you know what kind of compression or the strength of compression that you're going to get. Socks can be tight, but once you start to see these numbers, that's whenever you start getting into medical grade products for compression stockings. 15 to 20 is the basic. You won't get any lower than that. So that's usually the ones that you can find at Walmart's, Walgreens, stores that have pretty basic medical supplies. But the higher in number you go, or let's say you need a higher number, that's whenever you need a prescription from your doctor. So here I'm just showing you the other styles that come as compression stockings. So here, this is the hosiery style. As you can see that it's a thick hose appearance. Now, the reason that people don't like these, number one, these stretch out the quickest compared to others. So if you're doing this for compressive purposes because you have a diagnosed issue with your doctor, the hose ones you just need to replace more frequently. They may be more comfortable, they may look more appealing with clothes, but you have to have enough pairs that you're going to continue to get the compression that you need from these. Now, they do give compression, though. They are nice. And sometimes you want to be careful with the styles that you find. This, Dr. Comfort, of course, always has, thought about most things. This has this thick band at the top right here with the dress hose style stockings. Usually with the hose style, it just cuts off, and this will cause pressure where it's going to push into the leg right there, and people hate that, and so they end up not wearing their compression stockings, which defeats the purpose of having them in the first place. Look for that thick band whenever you're getting the hose style compression stockings. So the other type here, as you can tell, this is similar to the style that we are going to be applying, but this is the dress style. So it has this, kind of fashionable lined appearance. It also has the compression across the arch of the foot, but that's really the main difference. It does not matter what style you get whenever it comes to compression stockings. The main things that you're going to look for is this thick band here so that it's for comfort and you keep them on, and this 15 to 20 millimeter mercury or higher if your doctor tells you that you need something stronger medical grade. So this is the appearance of a compression stocking. It looks like a basic sock, but what you'll notice is a couple of things. Some of them have this little compression through the arch here. That's nice. That's really just for comfort. It's actually mainly in the leg area that you're going to notice the compression being the tightest. So that's right in here where you have a nice good pull. And depending on how swollen your leg is, let's say that you have some kind of venous disease that's causing it in the first place to need these, or you're a post-op patient and you just have some residual swelling. Maybe you've had a knee surgery or a recent injury higher up than the ankle, and that's causing some residual swelling. There's a bunch of different reasons why you would need these. But in particular, what you want to note is that the more swollen you are, the tighter these are going to be. So there's one way where you just pull the sock completely on, but I'm going to show you my trick of how to get these on. And it's actually by rolling the sock just like this. So you just roll into these little tube sections here, always keeping in mind where your heel is because that's eventually going to get covered. And so you roll it up until, see, I almost lost it here. You see it right there. You roll it until you get right to your toes. Okay, and so now I'm going to show you how to put those on. So, mind my sock. I'm just a little cold here today. But you're going to pull it on, and this is the easiest part to pull on. So now you've got it covering your toes. And this is going to feel pretty tight. But now, instead of having to pull that completely over, let's say a bandage that you have if you're still covering a post-op scar of some kind, or if you just have a ton of swelling and it's hard to pull this over your heel right here, now whenever you pull that, you're literally just going to roll right over the heel. And now it's smooth sailing, where you just wrap it and wrap it and wrap it and wrap it. And there you go. And that was a lot easier of a way to put on your compression stocking. Now, what I will mention is that the biggest reason people have problems with their compression stockings is that either they feel like it's pushing in right here at the leg, or it's pushing down here. If you're wearing some kind of a compression device that doesn't go all the way up the leg, and you're feeling tightness here, that's probably the problem, is that you need to elevate the level of compression that you have to above the knee. If you're going to go anywhere for a compression stocking to end, let it be at the contour of your calf right here. And that way you don't feel that pressure of that band pushing against you, and you're going to have a lot more comfort and wear these more compliantly. So that's just a quick overview of compression stockings, but if you have any additional questions, contact your doctor, or if you are in the DFW area, come visit us at Foot & Ankle Associates of North Texas.